you give an update on the number of patients that you're seeing at Helen DeVos Children's Hospital with COVID?
Right. So over the past few weeks, we have had a slow trickle of patients who are in the hospital who have COVID. These are all pediatric patients. Luckily, none of the patients have had really severe acute respiratory COVID, but they have needed to be in isolation. And some have had other interesting findings related to COVID-19 that are a little bit more rare side effects. I can't really talk about those in detail because the numbers are really small. So on any day over the past 2 weeks, we've had anywhere from 3 to 5 children in the hospital at a given moment with COVID-19 isolated from their nasopharynx. Also in the past 2 weeks, we have had one child diagnosed with the multisystem inflammatory syndrome in children. So we had over the course of the summer, we had one patient every 2 to 4 weeks. And then we just recently, like I said, had another case, and that child did require quite intensive medical care, as most of the patients with MIS-C will have.
Thank you. What should parents do if their kids are not feeling well before school this fall? Should you test them? Can you kind of walk us through that process?
Yeah, so that's definitely a hot question as people are going back to school next week. And the short answer is that they can always call the school for guidance, right? So if your child has new symptoms and you're concerned they could be related to COVID-19, always just call the school. Last year, most of us had surveys that we were filling out on a daily basis. Not all the schools are doing that this year. It's not necessarily a requirement from the health department this year. So if you have any questions or concerns, just call the front office so you can get some guidance on what to do. Another really nice resource for all the parents to have available to them is whatever county you are living in. Go to your county's health department website and look at the workflow for a patient, or I'm sorry, not a patient, a child who has symptoms that are potentially related to COVID-19, and it will walk you through the workflow for what would happen depending on if that person is vaccinated or not, and if they've had close contact with somebody known to have COVID-19 or not. So I think it's really helpful to have those resources bookmarked on your computer. So if you're in the moment and trying to figure out in your mind, oh goodness, does this mean I'm going to have to go to get a test or not? Then it can really help you in real time. If you can't find that, or if it's just the heat of the moment in the morning before leaving for school, certainly call your school. And I would err on the side of keeping your child at home and not getting on a school bus or not going into school until you have that sorted out, just so that you don't accidentally expose anybody else in case they are harboring the virus that causes COVID-19.
The next question is actually kind of a follow-up to that. So what are the thresholds of when kids should stay home? Like, is there a fever temperature? What about a runny nose? What a cough? Like, what are your recommendations for that?
Yeah, so like I said, the health department is going to have the most concrete data on that. So I do encourage people to go through that because it is almost easier to look at than to talk through. But many of the things are actually not any different from any other school year. So if your child has a fever greater than 101, they would, of course, need to stay home. And they will always need to stay home until they're fever-free for at least 24 hours, regardless of the cause. And if they are indeed diagnosed with COVID-19, then that mean that they would need to self-isolate at home for the full 10 days. So fever, certainly. The other big symptoms to look out for that would really increase the concern that this could be COVID-19, and you certainly do not want to have that child enter the school building or a bus, would be a new onset of a severe cough. And also a very specific symptom for COVID-19 is the loss of taste or smell. So that doesn't happen to everybody, thankfully, but if you do develop it, that's highly associated with having COVID-19. If you're having more mild symptoms, like a very mild runny nose and no other symptoms, your school may allow that child to participate. Again, refer to the county resources as well as what your school policies are, which do reflect your county health department. So there's so many different symptoms to report, it's hard to go through all of them. But generally speaking, a high fever, new onset severe cough, loss of taste or smell, any of those alone should keep your child home. More mild symptoms, a lot of times it depends on what the county health department says, and sometimes you need to have 2 or more symptoms to mandate testing or staying home.
Perfect. Thank you. Next question. What do parents need to know for COVID risk for school children? Is COVID still equivalent for the flu for kids? What are the dangers of serious illness and in perspective to other risks for kids?
Right. So there's been a lot of comparisons between COVID-19 and influenza. And I think as you look at a broader audience, from children up to adults, the comparison to influenza simply does not hold. Because we know that certain age groups and underlying conditions can really put you at much higher risk for severe disease from COVID than it would from influenza. For some age groups, specifically our very young children, influenza has a higher hospitalization rate than COVID-19. But for a teenager who may have underlying respiratory condition or obesity, COVID may indeed be more dangerous. So I think I really discourage people from drawing comparisons to influenza because, again, there's so many nuances and differences. So if you look at the whole pediatric population in general, depending on what state you're in, some data would say that COVID is worse for you than flu, and some states it says that COVID is less worse for you than influenza. So I think that comparison is really challenging. Certainly both are respiratory illnesses. Both can make you feel very ill, can give you days of high fevers, can give you a respiratory tract infection, which can make you very ill. And some children will need to come to the hospital from either. So I would probably just separate out those two in our minds, but think specifically about what COVID can do to children. That's a bit unique compared to influenza. So in the state of Michigan, especially in West Michigan, our hospitalization rate for all children who have been diagnosed with COVID-19 has ranged anywhere from 2.5% to 3%, depending on the month that you're looking at. So it's not a very high rate that when you have acute COVID, again, the acute respiratory tract infection, it's a relatively low hospitalization rate, which is great. However, just like influenza and many other common viral infections, there's the occasional child who will get severely ill from acute COVID and will need care even in our intensive care unit, and some have actually needed maximal life support. So that's one piece of it. But one syndrome that is completely unique to COVID-19 is a multisystem inflammatory syndrome, which is only due to COVID-19, occurs 2 to 8 weeks after you have been infected with COVID-19, and can cause a really severe inflammatory syndrome that needs to be cared for in the hospital environment, and sometimes can be life-threatening as well. And we have had a large portion of our patients with multisystem inflammatory syndrome that have needed to come to the hospital. So I think people do need to keep their mind on that because it's such an important consequence of having had COVID-19. And then lastly, we've tried to get some really good estimates on how many children who have had acute COVID will end up having long COVID. And that's the more chronic symptoms that you have after COVID-19, which can range from brain fog to poor concentration, all the way to exercise intolerance and blood pressure issues when you're going from laying to standing. So all of these are important consequences of COVID-19 that we need to think about a little bit in isolation or separately from influenza, because again, it's just a bit different. I think we all want to compare COVID-19 to influenza because we want to have something to hang our hat on and say, this is what we can expect. Unfortunately, being an expert in the field, I still don't feel comfortable enough with COVID-19 to give a prediction for how it's going to behave season after season. Influenza has been with us for centuries, and we now see a very predictable seasonal pattern, and we can predict a lot about influenza. COVID-19 has not kind of stabilized into a steady state yet. So we're not quite in that place where we can say, oh, this year is going to be this way or this year is going to be that way. There's still so many moving parts when it comes to this pandemic.
Thanks, Rosey. I'm going to jump into the chat because there's a whole bunch of questions in here. So let's see. So Kyle Mitchell, you gave the update on the number of kids at the Children's Hospital inpatient. He asked, has the Delta variant increased this number?
Yeah, so I would say that during the summer, before Delta variant came to Michigan, really we saw close to no hospitalizations for children who had COVID-19. And really that was the same for adults. We certainly had some patients in the hospital with COVID-19, but as we had a percent positivity rate down in the 1s to 2%, we saw very few people needing to come to the hospital for COVID-19. And that was the same for children. So that's great news. So now that we're seeing anywhere from 3 to 5 on a given day, yes, that is an increase. And I do think that is because we are seeing more people in West Michigan becoming infected with COVID-19. And we do know that the Delta variant is causing the vast majority of cases of COVID-19 in the state of Michigan. So I think the Delta variant certainly does influence that. We also know that the Delta variant is disproportionately infecting those who are unvaccinated. And of course that makes sense because those who have no immunity coming into it, they get exposed to this very, very contagious Delta variant. It makes sense that those who are unimmunized are those who are getting infected more. So I do think the Delta variant is playing into things. I do think that the fact that we do not yet have a vaccine available for children less than 12 certainly factors into that as well. And we do have concern that over the coming weeks, as people are going indoors more and congregating more indoors, that we will see more and more pediatric cases of COVID-19, both diagnoses, but then also hospitalizations. So we've tried to learn from some other areas of the country and of the world who have been dealing with the Delta variant longer than we have. And the jury is really still out as to whether the Delta variant carries a higher risk of hospitalization compared to the other variants that we have had. So far, the population data is not conclusive on whether the Delta variant is a more severe variant for children in particular. So unfortunately, I just can't give you concrete information on that at this time.
Thank you. WCCM is asking for comparison reasons, and if you don't know these numbers, we can get them to them later. What was the highest number of children admitted for COVID-19 at once, and when was that, and how does that compare to where we are now?
Right. So our highest number of children hospitalized with acute COVID-19 was in the spring. It was April or May. I can't remember exactly which month it was. And I believe our highest number of children in the hospital with COVID was 18. But I do want to mention that of those 18 that were in the hospital who had COVID, there were 5 of them at one moment who needed intensive care. And again, one that needed maximal life support. So we definitely saw with that surge in the spring of 2021, we definitely saw more children in the hospital very ill with COVID-19. So of course, we wonder if that is going to be the trend that we see as our numbers in West Michigan continue to rise.
The next question, if schools aren't requiring masks, what can parents do to protect their child around others who might not be wearing one?
Yeah, this is a really, that's a really challenging question because really the benefit of wearing masks in a whole group of people is that masks are very effective at capturing infected respiratory droplets as they're being expelled from the respiratory tract of somebody who is harboring the virus, even if they don't even know that they are sick with COVID-19. So it certainly is more effective if everybody in a group is wearing their masks so that nobody is expelling those infected particles out into the air around them. Now, that's not to say that wearing a mask for the individual doesn't have some benefit. It's just not as protective as if everyone around you is wearing a mask. But if you are yourself wearing a mask, you are less likely to inhale those infected respiratory droplets. It's not perfect, but it does decrease the amount that you inhale. And then also it will decrease the amount that you inhale if you do inhale some, and that generally leads to less severe disease. So I think that if you're in a setting where people are incompletely wearing masks or not the whole group is wearing masks, I do still recommend that the individual wear their mask and try to keep that physical distance as much as possible. If others around you are not masked, then I would go back to that 6 feet of distance or more in between individuals, because if they're not wearing a mask, then those respiratory droplets can travel much farther than if they were wearing a mask. And then certainly the physical distancing, of course, keeping an eye on the hygiene practices of your child, frequent hand washing, and things such along those lines.
Along those same lines, what are the risks associated with athletics for kids in COVID? How can parents reduce any potential risks?
I'm sorry, I missed the first part of your question.
I'm sorry, it was what was the risk associated for athletics for children in COVID? How can parents reduce any potential risk? Yeah,
so that's also a very hot topic, and we have seen that the risk of spreading COVID and contracting COVID with athletics depends on the sport and where the sport is being played. So those athletics that are being played outdoors and where there's more space, the risk is significantly lower than if you're talking about a close physical contact indoor sport. So wrestling and basketball were the ones to be demonstrated to have the highest risk of passing it on between teammates. So in those settings, of course, some areas do test more regularly for their participants, and vaccinating in those populations can be extremely helpful. And then if you're doing an outdoor sport where there's more distance in general, you can just breathe a sigh of relief. Generally speaking, it's much more difficult to contract COVID-19 if you're outdoors with that excellent ventilation of open air.
Thank you. Next question is, how protective is natural immunity? If a child has COVID, is it the same as being vaccinated? And since the disease tends to be fairly mild for young children, why not encourage natural immunity for that group?
Yeah, that's a really wonderful question. And it's been on the front of our minds since the beginning of the pandemic. And we still have ongoing study to figure out whether or not natural immunity or vaccine generated immunity is superior and more longstanding. So we've had data from a few months ago that showed that the natural immunity from having a COVID-19 infection probably lasts at least a year. And that's great news for those who have already undergone COVID-19. Now we have seen that in the past couple of weeks, there's been a lot of buzz about the waning immunity for those people who have been vaccinated. And so much so that, we have seen that the vaccine efficacy for people who are vaccinated many, many months ago when the vaccine was first available in December and January of this past year, are showing that the vaccine efficacy, so your defense against COVID-19 is dropping. So that is more likely due to waning immunity rather than the Delta variant, although the studies on that are not completely clear yet. So in order to keep that immunity high and to keep individuals safe and protected, a booster dose is recommended 8 months after you received your second dose of the COVID-19 vaccine. And this is for normal, healthy teenagers and adults, not the immunocompromised. That's a slightly different topic. I do want to mention, however, though, I mentioned that the vaccine efficacy for preventing an infection has waned. So meaning if you've been vaccinated 8 months or longer, that you still could get infected. But the great news is that even if you do get infected, the efficacy in terms of keeping people out of the hospital is still excellent. It's still nearing 90% of keeping people out of the hospital. It was 95% right after people got the second dose. So there is still a lot of great benefit for having been vaccinated. So we don't quite know yet if the natural immunity or the vaccine generated immunity is superior over the long term. Again, those studies are ongoing and we're looking for that data constantly. So I can't really give you a perfect estimate of that. However, I do want to say that because the adverse effects of having a vaccine are so extremely low, and the risk of having a negative consequence of COVID-19 probably ranges anywhere from 3 to 10% for a child, that it certainly does favor vaccination for children. Again, assuming that the vaccine that comes out for less than 12-year-olds is as safe and effective as what we found from the adolescent study from this past year. So I do still think that vaccination is the safer way to get a population immune to the virus in terms of the negative consequences that could be experienced from getting vaccinated compared to natural infection.
Thank you. Next question kind of goes along that same lines. If vaccines are recommended by the CDC for kids under 12, is that something you would think would be important to get for kids to get, and why?
Yeah, so we are anxiously awaiting the Pfizer trial in children 5 to 11 years of age so that we can see that safety and efficacy data. Assuming that the study shows as great safety and efficacy data as it did for the adolescents, then the next step will be for the FDA to issue an emergency use authorization for the vaccine in that age group, 5 to 11 years. If indeed that does happen, I think it is incredibly important for children in those age groups to be vaccinated. This is a group of people who in the schooling environment has a high risk of spreading COVID-19 amongst their classmates and their staff, especially if they're unvaccinated and especially if they're not using other mitigation strategies. Also, children in the United States make up 25% of the population. I can't quote off the top of my head how many of those are the 5 to 11-year-old. It's obviously going to be less than 25%, but let's say they make up 10% of the US population. Getting immunity in that group of individuals will absolutely be huge in talking about the overall herd immunity to COVID-19 for our larger communities. So I do think it is a very important, not only for the health protection of the individual, but for the community level protection in terms of preventing future surges and emergence of novel variants.
I'm going to skip one question just to do another follow-up. Do we have any sense of when the COVID vaccines could be approved for kids under 12?
Yeah, the current thought is that we're looking at December or January, February of next year. Again, we're waiting for the Pfizer study to be conducted so the safety and efficacy data can be reviewed. And then again, that would have to go through the FDA emergency use authorization process, which does take a little bit of time as well. So the most recent estimate I heard is probably December or January.
Perfect. Thank you. And Live is asking, should parents be concerned if the school is not requiring sick kids to stay home and or not letting parents know if their kids have been exposed to COVID?
Yeah, so really the prevention of the spread of infections in schools and daycares goes back way before the pandemic. And it's so routine and mundane that most parents don't even realize it's just part of our natural behavior, is making sure we're not sending our child to school sick. So that really is something that predates the pandemic and will continue to be important. You know, we don't want to see RSV, influenza, strep, all of these other things being spread in the schooling environment. So regardless of COVID-19, children are not allowed to come to school when they're significantly ill. Again, with a fever, a severe cough, the loss of taste or smell is obviously a new one on the radar. You know, if they're vomiting or having diarrhea, none of these things are appropriate for children to be in school, again, because of that close contact with individuals for the whole school day. So the health departments are recommending that contact tracing be undertaken within the schools. If somebody comes into the school and they are diagnosed as having COVID-19, still that contact tracing does need to still happen. So please do check your county health department's policies and procedures on that. But I know for our most local counties to the Children's Hospital, that is what the plans are for this year. Now, I will say that if schools carry out the same mitigation strategies as they did the last academic year, which were the multiple mitigation strategies, including mask wearing, a minimal physical distancing, ventilation, and hygiene practices, that was so effective at preventing COVID outbreaks in schools that we were able to take away some of the quarantine that the contacts in the classroom had to undergo. So that's another huge benefit of using those mitigation strategies, is the less likely that you will have to quarantine if you were using the mitigation strategies, and especially if you're vaccinated. So a lot of huge benefits there for keeping schools open and operating.
Thank you. How many children has Spectrum seen that have had to be hospitalized because of a side effect to the vaccine? If that's something we have to look up, we can get back to Julia on that. But how does that compare to the total number of pediatric hospitalizations for COVID?
Yeah, that's a great question. So the main serious adverse effect of having a COVID-19 vaccine is something called vaccine-associated myocarditis. This has been reported in the US since we started using the mRNA vaccines in our adolescent population. And there's really great information on the CDC website that talks about the number of cases that have been reported and the ones that have been confirmed to actually be vaccine associated. This was kind of a confusing topic because during the summer months, we actually can see heart inflammation resulting from natural viral and bacterial infections. And so we in the infectious disease world, we consult on all of these patients to figure out what exactly was the trigger that caused this inflammatory episode to happen to the heart muscle. Now, in West Michigan, we have cared for 5 children who have been hospitalized with vaccine-associated myocarditis, and we were not able to find another infectious trigger for that. And we report all of the cases, whether they're suspected or confirmed. All of those cases are reported to the CDC so that a thorough data analysis can be done. So 5 patients over the course of about 4 months we cared for with this condition. Luckily, it's very self-limited and the children get better very quickly with the simple use of ibuprofen. And our cardiologists are following them long-term to make sure they get back to a normal state of heart health. So if you compare that to the number of patients that we've cared for with acute COVID in the hospital, I actually can't tell you the number of patients because there have been so many. And again, it fluctuates on a day-to-day basis. But I think the other serious condition that I'll just draw the easiest comparison to is the multisystem inflammatory syndrome that you can get from COVID-19. We've cared for a total of 37 patients over the course of the pandemic from that inflammatory syndrome, which is life-threatening and requires really intensive medical care compared to those who have had the vaccine-associated myocarditis. Now, the timeframes for reporting these two things are very different, right? I'm talking about the vaccine-associated myocarditis, which has been over the past handful of months, versus the other experiences over the past 18 months. But if you look at the risk on the national level for developing vaccine-associated myocarditis, it's around 1 in 100,000 second doses of the COVID-19 vaccine. So that's a attack rate of about 0.001, I believe, if my math is correct. So 1 in 100,000. And you can compare that to the combined risk of hospitalization, multi-system inflammatory syndrome, or long COVID, probably somewhere altogether ranging between 5 and 10%. Of course, then you would see the safest practice is for vaccination to prevent those other serious consequences of COVID-19.
Thank you. WCZM is asking, are there any concerns as far as an increased surge, seeing that increase in childhood COVID hospitalizations as school begins?
Yeah, so we are concerned certainly that could happen as we see that the Delta variant has really gone really quite rampant in our southern states, and obviously going back to school does confer additional risk. So I think it's even more important knowing that Delta is here and that it is so contagious for us to use the tried and true mitigation strategies within the school environment. Now, if we can do that, if we can prevent widespread transmission in school, if it will remain that the secondary transmission of COVID within the schooling environment remains very, very low like it did last year, then school itself probably will not cause a huge rise in COVID-19 cases in our community. What we saw in the spring when the B.1.1.7 variant came through Michigan, which is more contagious than the initial variant that came through West Michigan, we saw that, if there were activities that were participated in associated with school, such as sporting events or socializing or just hanging out after school, it was actually those events that were more tightly associated with spreading COVID from person to person in the school age group. So we do have to be very thoughtful about what is actually going on at school and what is going on that's associated with school. Within the schooling environment, obviously, there'll be rules and regulations and things that are followed to protect all of the children. And once you leave school, if you're in groups with those same people that you went to school with, you should try to adhere to those mitigation strategies as much as you can as well. So we certainly want to prevent a huge surge in cases as people go back to school. So again, those mitigation strategies are even more important, especially because our youngest patients are not vaccinated and because this variant is so incredibly contagious.
All right, last question from MLive. How much should parents worry about COVID for school age kids? Some parents are in a complete panic. Others think there's no risk at all. How do you suggest parents weigh the risk?
Yeah, I think some of the statistics and data that I gave you earlier about acute respiratory COVID, the multi-system inflammatory syndrome, and long COVID, hopefully that gives you a sense of the risk to children. It's certainly not zero, but it's not as high as if you were, an 80-year-old person with heart disease. So there are differences there, but there is some risk. Now, we really would like to prevent any COVID-19 infection that we can because of the occasional very negative consequences that children can experience. However, we know that not being in a schooling environment is also very challenging for children and can lead to very negative consequences for them, from their academic performance to their mental health. So the data is quite clear that the more that children can be in an in-school environment, if that's appropriate for them, is certainly beneficial for the whole child. So as we weigh the risks of being in the school because of COVID with the risks of not being in school and all of the negative consequences come from that, I think certainly it favors children being in school, but I think the big thing is that still needing to try to prevent infections, and especially the potential for the virus to run quite efficiently through a school if no mitigation strategies are adhered to. So that's why we think these mitigation strategies are incredibly important for this upcoming school year, so that we can counterbalance and make it an acceptable risk for your child to go to school and reap all of the benefits of in-person education.
Perfect. Dr. Rosemary Olivero, thank you so much for your time today. We appreciate you. If media has any other questions, please feel free to follow up with Rick or myself.
Thank you.